Fruits are healthy, right? They're packed with vitamins, low in fat, and straight from nature. You've been told to eat more of them, not less. But what if I told you that for seniors, some of these seemingly innocent fruits could actually do more harm than good? They might spike your blood sugar, dangerously interact with your medications, worsen heart or kidney problems, or even trigger gut issues you never saw coming. Yes, fruits, something as simple as a banana or a bowl of cherries, can turn dangerous if you're over 60 and not careful. In this video, we'll reveal the 8 fruits you should be extremely cautious with as a senior. We're not here to scare you, we're here to help you make smarter, safer choices. Because sometimes staying healthy isn't about what you eat, it's about what you choose to avoid. Stick with me. What you're about to learn could save your heart, your kidneys, and possibly even your life. 1. Grapefruit, the silent medication killer. Grapefruit is perhaps the most well-known fruit with a red flag warning, yet many seniors still don't realize just how dangerous it can be. This zesty fruit is packed with vitamin C and antioxidants, and it's often recommended for boosting the immune system or adding a tangy flavor to breakfast. But grapefruit isn't just another fruit. It contains chemical compounds called furanocoumarins, which interact negatively with a long list of prescription medications. When you eat grapefruit or drink grapefruit juice, these compounds interfere with an important enzyme in your liver called CYP3A4. This enzyme is responsible for breaking down many commonly prescribed drugs. Without it functioning properly, medication can build up in your system to dangerous levels. Here's a glimpse of just how many medications can be affected. Statins, like atorvastatin or simvastatin, for lowering cholesterol. Calcium channel blockers like felodipine for blood pressure. Benzodiazepines like diazepam for anxiety. Certain antiarrhythmic drugs for heart rhythm. Immunosuppressants for organ transplant patients. Even some antihistamines, painkillers, and mental health medications. If you're a senior on multiple medications, and let's be honest, many are, it's crucial to avoid grapefruit unless your doctor has cleared it. Even a small glass of juice can change how your medication behaves in your body, leading to either dangerous side effects or making the drug ineffective altogether. Key takeaway: if you're on any regular prescription medication, avoid grapefruit completely unless your healthcare provider specifically says it's safe. Even healthy fruits can become hazardous when mixed with the wrong chemistry. 2. Bananas, a potassium overload in disguise. Bananas are considered the go-to fruit for seniors. Soft, easy to chew, high in potassium, and gentle on the stomach. But what if you have kidney problems or heart issues? Then bananas can be a dangerous trap. Here's why. Bananas are extremely rich in potassium. One medium banana contains over 420 milliliters of potassium, which is around 10 to the daily recommended intake. For most healthy adults, that's not a problem. But for seniors, especially those with chronic kidney disease, CKD, that potassium can accumulate to dangerous levels in the bloodstream. Your kidneys are responsible for filtering excess potassium. As we age, kidney function naturally declines, even in those who aren't officially diagnosed with kidney disease. And if you're already taking medications like ACE inhibitors or ARBs for blood pressure or heart failure, your potassium levels could rise even higher. What does high potassium do? Causes muscle weakness and fatigue, leads to irregular heart rhythms or arrhythmias. In severe cases, can result in sudden cardiac arrest. Another hidden danger is that bananas are often eaten with other potassium-rich foods, like orange juice, potatoes, or leafy greens, creating a cumulative overload. Who should be cautious? Anyone over 60 with declining kidney function, seniors taking diuretics or blood pressure meds, people with heart rhythm issues or who've had cardiac events. Moderation matters. One banana every now and then might be fine, but if you eat them daily and already have kidney stress or heart risk, they can become a silent threat. 3. Dried fruits, the sugar and sulfite bombs. Dried fruits like raisins, dates, apricots, figs, and prunes are often praised for their fiber content. Many seniors use them to relieve constipation or snack on them as a healthy alternative to candy. But don't be fooled. Dried fruits are extremely concentrated sources of sugar. Let's take a closer look. One small box of raisins, about 1.5 Aussies, has nearly 30 grams of sugar. Off dried dates contain roughly 60 grams of carbohydrates. Prunes and dried apricots are often treated with sulfites to maintain their bright color. These preservatives can trigger allergies and digestive irritation in sensitive seniors. Not only can this overload your system with quick-burning carbs, but for diabetics, this is a blood sugar nightmare. Dried fruits have a high glycemic load, meaning they spike your blood sugar quickly and dramatically. And because they're so small and concentrated, they're incredibly easy to overeat. You can eat 15-20 grapes and feel full, but 15-20 raisins barely fill your palm, yet they pack the same sugar and more. Seniors with diabetes, insulin resistance, or even borderline glucose issues should avoid dried fruits or limit them to small, carefully counted portions. And always choose unsweetened, unsulfured versions if possible. 4. Watermelon. Hydrating, but misleading. Watermelon is 92% water. It's hydrating, refreshing, and delicious on hot days. But for seniors, especially those managing blood sugar, digestion, or kidney balance, watermelon can be a double-edged sword. Watermelon ranks very high on the glycemic index, meaning it can cause a quick and sharp rise in blood glucose. 1 cup of diced watermelon contains about 9 grams of sugar, but because of its water content and lack of fiber, it passes through your digestive system extremely fast. That's bad news for seniors with diabetes, hypoglycemia, or insulin resistance. Watermelon won't fill you up either, so it's easy to keep snacking and unknowingly consume 3 to 4 cups, which could mean 30 to 40 grams of sugar in a single sitting. There's also a diuretic effect to consider. Because of its water content, watermelon can make seniors urinate more frequently, which could worsen dehydration in hot weather or after taking medications like diuretics or blood pressure pills. And then there's the bloating factor. Watermelon contains fermentable carbohydrates, aka FODMAPs, that can cause gas and abdominal discomfort, especially in seniors with IBS, diverticulitis, or slower digestion. Bottom line, a small slice now and then is fine, but don't make watermelon your go-to daily fruit if you're managing chronic conditions. 5. Mango. Tropical sugar spike hidden in every bite. Mangoes are one of the most beloved tropical fruits in the world. They're juicy, sweet, and packed with vitamins like A, C, and E. But here's the problem. Mangoes are also one of the highest sugar fruits seniors can eat, and that sweetness comes with serious consequences. Just one medium-sized mango contains around 45 grams of sugar and close to 50 grams of carbohydrates. That's more than a typical chocolate bar. Unlike fruits like apples or berries, which have more fiber to slow down sugar absorption, mangoes are low in fiber relative to their sugar content, causing blood glucose spikes almost immediately after eating. Why is this especially dangerous for seniors? Many seniors have prediabetes, diagnosed or not. Blood sugar spikes after meals can lead to brain fog, fatigue, and inflammation. Chronically elevated glucose levels increase risk for neuropathy, vision loss, and kidney damage. Mangoes are also often paired with sticky rice, ice cream, or blended into smoothies, amplifying the sugar load even more. And if that wasn't enough, mangoes are rich in a chemical compound called urushiol, which is the same compound found in poison ivy. Some people, especially those with sensitive skin or immune systems, can develop allergic reactions to mango skin or even the sap. So should seniors stop eating mango completely? Not necessarily. If you're going to eat it, limit your portion to just a quarter or half a mango, pair it with protein or healthy fat to slow down sugar absorption, and avoid it altogether if you're managing blood sugar or have inflammatory issues. 6. Cherries. Inflammation's sweet frenemy. Cherries are often hailed as a superfood, especially for seniors dealing with joint pain or inflammation. They're packed with antioxidants like anthocyanins, which can reduce markers of inflammation and help ease arthritis or gout symptoms. But here's the twist. Cherries are sneaky sugar carriers, and for some seniors, they may do more harm than good. Let's break it down. 1 cup of fresh cherries contains over 17 grams of sugar. That's without anything added. Canned cherries or dried cherries. They often come with added syrups or sweeteners, doubling or tripling the sugar load. Cherries are also acidic, which may worsen acid reflux or GERD, common issues in seniors. But perhaps the biggest problem? Overconsumption. Cherries are small and easy to snack on. Before you know it, you've eaten 2 to 3 cups. That's the sugar equivalent of a full-size soda bottle. And unlike citrus or apples, cherries don't have as much soluble fiber to slow digestion, making them fast-absorbing sugars, dangerous for those managing diabetes or insulin sensitivity. Another overlooked concern, cherry pit ingestion. Seniors with dentures or poor vision can accidentally swallow cherry pits, which can cause choking or intestinal obstruction, especially dangerous if you have diverticulosis or digestive problems. So while cherries do have health benefits, they should be eaten sparingly. Aim for a half-cup portion and always go for fresh, unsweetened varieties. Section 7. Canned fruit cocktails. Sugar traps in disguise. Canned fruits are often seen as a budget-friendly, convenient option for seniors, especially those with limited mobility or access to fresh produce. But there's a dangerous trade-off hiding in that colorful can: added sugar, artificial syrup, and preservatives. Most canned fruit, like peaches, pears, and fruit cocktail blends, are packed in heavy syrup, which contains glucose, fructose, and sometimes high fructose corn syrup. Just 1 cup of canned fruit cocktail in heavy syrup contains over 30 grams of sugar, zero fiber, and often less nutritional value due to the canning process. What does this mean for seniors? Increased risk of type 2 diabetes, worsened inflammatory conditions, higher triglyceride levels, which affect heart health, potential interaction with blood sugar and blood pressure medications. Many canned fruits also contain BPA in their linings, a chemical linked to hormonal disruption, especially concerning for aging bodies with sensitive metabolic systems. Even light or in-juice versions aren't always innocent. They may still contain concentrated juices or be sweetened with fruit-derived sugars that act just as rapidly in your system. If you must use canned fruits, look for no sugar added or packed in water varieties. Rinse the fruits to remove excess syrup. Better yet, opt for frozen fruits with no added ingredients. Remember, convenience should never come at the cost of your long-term health. Section 8. Papaya. Gut hero or hidden gut irritant. Papaya is often praised as the ideal fruit for digestion. It contains papain, an enzyme that helps break down proteins in the stomach and eases bloating and indigestion. So why is it on this list? Because for seniors with ulcers, acid reflux, or certain medication regimens, papaya can actually worsen your symptoms. Let's take a closer look. Papaya is a natural laxative, which can be dangerous if you already take diuretics, fiber supplements, or meds that alter bowel activity. The enzyme papain can thin the blood, especially in large amounts or when paired with anticoagulants like warfarin, aspirin, or Plavix. Seniors with low platelet counts, bleeding disorders, or who bruise easily should avoid excessive papaya. There's also evidence that unripe papaya may cause stomach upset, contractions, or toxicity in some people due to latex content. Another issue? Allergic reactions. Some seniors experience tingling, itchiness, or swelling in the mouth or lips after eating papaya, especially if they're sensitive to latex or tropical fruits like kiwi and pineapple. Papaya isn't inherently bad, but it should be treated more like a functional food than a snack. Use it as a digestive aid if your doctor approves and don't overconsume it. Watch how your body responds, especially if you're taking medication or managing gastrointestinal sensitivities. The takeaway every senior should remember. Let's be clear. This video isn't telling you to fear fruits. They are, without question, powerful tools for nutrition, disease prevention, and energy. But as we age, our bodies change. Our digestion slows, our metabolism shifts, and medications become part of daily life. What was once a harmless snack in our 30s may suddenly become a danger in our 70s. The line between helpful and harmful gets thinner, and fruits, though natural, are not exempt from that reality. Here's what every senior should remember. Talk to your doctor or dietitian about any fruit-related risks specific to your medications or conditions. Watch your portion sizes, especially with sugar-dense fruits like mangoes and cherries. Avoid canned and dried fruits when possible. Fresh or frozen is almost always safer. Listen to your body. If something doesn't sit right, causes bloating, fatigue, or strange reactions, it may be a red flag. And most importantly, you don't have to give up fruit, but you do need to be smarter about which ones, how much, and when. If this video helped you rethink your plate, or even saved you from a risky food choice, give it a thumbs up and share it with a friend or loved one who needs to hear this. We believe aging shouldn't mean confusion. It should mean empowerment. And the best way to stay strong, alert, and independent? Knowledge. Subscribe to Elderly and Wise for weekly videos just like this, packed with practical tips, medical truth, and wisdom for seniors who want to live better, not just longer.